This is an analysis of the osteoporosis screening rate in a local family practice clinic. My name is Wanda Mooney, and I'm a graduate student at ASU, and I would like to also acknowledge Dr. Savannah Coyne, who's my clinical instructor, and Dr. Christopher Jordan, who is my professor as well as my mentor. Osteoporosis is a debilitating bone disease which is characterized by low bone mass and has the potential to cause bone fractures that can negatively impact the elderly's morbidity and mortality. The focus of this study is geared toward postmenopausal women, as they are considered to be the group that is most at risk. It is beneficial to determine the bone density screening rates locally to ascertain how closely these rates compare to the national average. The purpose in screening for osteoporosis is to identify those patients who have low bone mass and provide appropriate treatment prior to them suffering from a fracture. Additionally, the United States Preventive Task Force recommends bone density testing beginning at age 65 for this patient population. This slide is an example of what the normal bone density would look like, comparing that to one that has been affected by osteoporosis. The objective of this study was to compare the number of female patients aged 65 to 85 who have had a bone density screening prior to a fracture versus those who have not. The data for this project was collected utilizing a retrospective chart review, and all charts were randomly selected. 50 charts were selected by searching for the ICD code, which represents the encounter for screening for osteoporosis. The data was only used from patients that were seen in the clinic within a year time frame from November 1st, 2018 to November 1st, 2019. Of course, all male patients were excluded from this research project, and any female patient who was younger than 65 or older than 85. Of the 50 female patients aged 65 to 85, 32 had an indication within their medical record for osteoporosis screening, and 18 did not. This calculates to 64%. When comparing that rate to the national average of 76%, this gives a 12% variance. It's well understood that decreased bone density can lead to fractures. Studies have shown that 1 in 2 women will break a bone in their lifetime due to osteoporosis. For women, the incidence is greater than that of a heart attack, a stroke, and breast cancer combined. This screening should be encouraged, and it is covered by Medicare initially and every 2 years following any necessary treatment that might be prescribed. The results from this study will allow clinic administration to identify an opportunity for improvement regarding inadequate practices in an effort to positively impact the health of this vulnerable patient population.